Welcome everyone back to the Reinhartz Rundown. Today we're taking an audience question. The question is, can you explain why some patients can take codeine and hydrocodone, but not others? We're going to take some time to review background first. When we take medications, they get metabolized by enzymes in the body where the drug is broken down and the drug can then be eliminated from our body. The biggest enzyme system is the cytochrome P450 system, which we've been calling the CYP enzyme system. Here's where it gets a little bit tricky. Now last week we talked about DNA polymorphisms encoding for our CYP enzymes, which can influence how fast drugs are metabolized out of the body. For CYP2D6, the enzyme responsible for codeine and hydrocodone metabolism, this is a particularly big deal. Let's look at codeine. Codeine by itself is a prodrug, meaning it does not produce analgesic response alone. Enzyme 2D6 metabolizes about 10% of codeine into the active drug morphine, providing analgesia and pain relief. With 2D6 polymorphisms, a patient can be a poor metabolizer, an intermediate metabolizer, an extensive metabolizer, or an ultra-rapid metabolizer. Looking at a poor metabolizer, very little codeine gets metabolized to morphine. This means the patient is less likely to experience morphine overdose, but also less likely to have pain relief. Most of our patients are going to be extensive metabolizers, metabolizing that expected 10% or so of codeine to active drug morphine. Ultra-rapid metabolizers, on the other hand, will convert too much codeine to morphine, putting the patient at risk for oversedation, respiratory depression, overdose, and death. This risk of ultra-rapid metabolism is also why medications like codeine and tramadol are contraindicated in pediatric patients less than 12 years of age. Circling back to our question, patients who are ultra-rapid metabolizers should typically avoid codeine, hydrocodone, oxycodone, even tramadol, because genetic differences can affect how effective these medications are and possibly put the patient at risk for overdose. Data shows that while 60% or so of our patients metabolize just fine through 2D6, up to 40% are either poor metabolizers or the dangerous ultra-rapid metabolizers, meaning that no matter your practice setting, this is a concept clinicians really must be familiar with. That's the Reinhartz Rundown. Make sure you subscribe for our next update.